Welcome to the video identifying patients who are eligible and would benefit from a health assessment. For the purpose of this video, we are using simulated data only. To keep up to date with our latest videos, hit the subscribe button, select all notifications, and if you like the video, give it a thumbs up. Open Polar, select Reports, then select Clinic Summary Report tile. You are now on the Clinic Summary dashboard page. For the purpose of this exercise, we are going to select the RACGP and Practice Active Patients shortcut on the right-hand side. In the dark ribbon, open the MBS drop-down list and select Tracked MBS. The report will default to opening on the GP Management Plan focus, which is indicated by the little eye icon on the focus column in the table up the top left-hand side. You can change the focus by selecting other tracked MBS items. For this exercise, we are going to select 75 plus health assessments. You will now see the current focus has changed to read 75 plus health assessments. In this table, columns consist of focus, tracked MBS items, eligible cohort number, the number of patients who are active and RACGP active and over 75 years of age, active, the number of patients who have had a 75 plus health assessment in the previous 12 months, active review is not applicable for health assessments, to action, the total number of patients who are eligible for a 75 plus health assessment, expired, eligible patients who have previously had a 75 plus health assessment, but this has now expired. Never had, the number of patients who have never had a 75 plus health assessment at your practice. Partially claimed, eligible for renewal and eligible for review are only applicable for GP management plans and team care arrangements. Potential anomalies. This is for informing the user to potential anomalies that may have occurred in the claiming of this item. Claimed in a calendar year, number of 75 plus health assessments claimed in a calendar year, claimed in a financial year, the number of 75 plus health assessments claimed in the financial year. Hovering your mouse over the items in the columns will give you a description of the criterion. Note the color-coded columns match the selector buttons below. There is an export shortcut on the very right-hand side which will export this table to Excel. Moving to the middle section of the page, you can identify that the current focus is 75 plus health assessments. To the right, you will see three buttons under Tracked MBS Review Eligibility, labelled 3 months, 6 months and 9 months. We have covered this in a previous video, GP Management Plans, and it is not applicable in the health assessment search. The color-coded sections allow you to select the cohort of patients you want to identify. Hovering your mouse over the eye will give you a full description of the patient cohort. For health assessments, we will be using the red to action items to identify your patients eligible for a 75 plus health assessment. The blue section, partially claimed, is only applicable to GP management plans and team care arrangement MBS items and is not applicable to 75 plus health assessments. The green section, fully claimed, enables you to identify patients who have had a 75 plus health assessment with an MBS item claimed in the previous 12-month period. The yellow section, potential anomalies, has a list of patients that have potential anomalies in the claiming of the 75 plus health assessment. When you select potential anomalies, you can hover your mouse over the eye and you will be able to see the anomaly codes. The table will default to the combined list of patients who have either had a 75 plus health assessment in the past and this has now expired, and patients that have never had a 75 plus health assessment. Both cohorts will be included in a single Excel spreadsheet. If you wish to select all patients that are eligible, click the Select Combined button. The table underneath will populate with patient details and will now include the date of the last health assessment and the most seen doctor. To export the patient list, go to the patient list in the dark ribbon at the top right-hand side. The patient list will populate, then you will have the option of exporting to Excel. To go back to the Tracked MBS page, select the Back to Tracked MBS at the top right-hand corner. We will now clear any filters in the ribbon except the patient status active and the RACGP active filters. To select only the patients that have had an assessment in the past but this has expired, you can click the Select Expired button. Go to the patient list up the top right hand side, and once the list loads you will have the option to export to Excel. If you found this video helpful, remember to subscribe to the MPN YouTube channel and give the video a thumbs up. Thank you for watching and see you in the next video.